All right, now to take some perspectives on our fight against coronavirus disease. So far, we have with us in our Abuja studio the president of the Nigeria Medical Association, Dr. Francis Fadile. Thank you so much for your time this morning. So far, the NCDC has tested 8,000 plus, going to 9,000 so far, and 873 confirmed cases, and a significant number of 197, almost 200 discharged. Are you comforted with our approach so far?
Thank you very much. I think as it is, we have to congratulate the NCDC for being able to improve on the number of testing capacity. However, the total number that we have tested is still a far cry from what is expected to be able to take care of those that are suspected to have had contact to patients who are COVID-19 positive. And it is important for us to stress that it is the testing that will help in containment of this COVID-19 infection, because until we test a large number of Nigerians and those who are positive are identified and possibly isolated, it is at that time that we know that we are going in the right direction to be able to stop the spread of COVID-19.
But then, talking about testing, you are not unaware of the strategy that the NCDC, the government, have decided to approach, which is the molecular testing, which is said to be a lot more reliable than any other. If we are to ramp up testing, what would you suggest?
I will have two suggestions. One, while it is very desirable that we continue with the molecular testing, but as a pathologist, and we have this large number of people who are likely infected, it is good that we have these mass testing kits, which should be able to bring out those that are positive preliminarily, and which we can do a confirmatory with this molecular testing. And with that, we can now take off those who are possibly negative from clogging the wheel of the test for the confirmation test. And the second way is that if we continue to have this molecular testing, which is not rapid, we'll continue to have a time lag between the time that these samples are taken and the test result comes. And the question is, what happened during that interregnum? Where will you keep the patient? What will you do to the patient? How will you want to manage the patient, especially now that we have had community transmission established within the country? It calls for a lot of efforts by our scientists, and on the part of Nigerian Medical Association, we are looking at ways of possibly validating one or two of these mass screening kits. Once we validate it and we see that some of the one that is validated is giving a fairly very accurate, reliable results, we will suggest to the government that we need to have this mass screening so that we can take care of a large number of patients and will be able to put patients or triage patients and know how to treat them. Nowadays, we are having patients who are coming to the hospital and they are not given the adequate treatment because the attending physicians are not sure of the status of the patients. And this is where the mass screening test will come in and can help in resolving some of the issues that we are facing generally.
You know, so far we have seen that the WHO has been very careful in recommending any rapid tests, saying, you know, the issues with validation. So if we're looking at a point where Nigeria will maybe try to validate some of its tests, and then the WHO is saying, well, we have not validated any of these tests, where does that place Nigeria?
Well, I think it's important for us to know that every country has a way of developing its own homegrown method of resolving issues that are in front of them. The lockdown in Nigeria in the last 3 weeks that we have been in lockdown has been plagued by different issues that are primarily not related to the lockdown. And today we are discussing issues that we want to be like, we want to be an adaptation of Nigerian type of lockdown. So Nigeria, we must know, is not a very, very rich country. Our patients are not very capable of getting all the necessary payment for health, and the health system is weak. We cannot afford to get overwhelmed before we will start asking for whatever can be done for us to identify people who are positive, and for us to be able to quickly isolate them. The more we keep them in the community, the higher the risk of them contacting other members. And we shouldn't forget that our housing system is different from those in the other clime. We ramp ourselves, so many of us can stay in the same room, and we do not have alternative. The government also does not have alternative of keeping a lot of those people who are positive. So we need to find a way to rapidly identify those who are positive, have a way of taking them out of the public circulation so that we can resolve this transmission in the community.
So you just talked about the peculiarity of Nigeria. You talked about a Nigerian type of lockdown. I mean, you've seen the measures taken so far by the government, and I'd like us to touch on some of these measures. How custom-made do you think they are for Nigeria? Because Nigeria is different from, you know, every other country. So in terms of the lockdown, even this policy regarding testing, looking at them for you, how custom-made, how well, you know, well custom, I should just say that, for Nigeria are those measures?
Well, you see that a lot of Nigerians are resisting this lockdown. It's not out of not believing that it is necessary. It is because they need to eat. And we have the palliative that the government has put in place. Unfortunately, it is not going as it is expected. And once it's not going as it's expected, then people need to eat. Most Nigerians are not fully well. They don't have. They are daily wage workers, and they need to find a way to eat. So, what government must do is to find another source in which you have to get Nigerians to get the food. Not even the money, because if you have the money, you will still need those money to go to the market. And this is one of the areas that we are trying to guide against large gathering. So it's a two-way thing. We really need the government to get food. We need the state governments to get things that people will eat. But it is important for them to forget at this time politics, because what we have seen in a lot of them is that they have some political coloration in the distribution of these palliatives. We need to know that every Nigerian is an important person that we need to take care of so that we can contain this virus. If we allow the time we have now, that we could not stop this progression, it can get to a position that everybody will now have to be panicking. And at that time, I don't think it will help the country, Nigeria. It is important we do the needful now.
Absolutely. I'm sure that's something we're not looking forward to. But when you said earlier that there's political coloration, you think there's political coloration in some of these measures. What do you mean, and where have you seen, those instances?
Well, I don't want to push it further than that, but to say that we have had a lot of complaints of people staying in the community, claiming that they have not seen any of the palliative. We have some cases in which we have seen people who had claimed that they have just come to take a picture of them while collecting some amount, and after that they give them some peanuts after. We have had a case in which we have a large number of communities saying they are still waiting for the palliative. It means that the palliative is not going around, and once it's not going around, any single person that is not satisfied and leaves the house to go to do things that is against the lockdown, then it means that that is our weakest link. And until we are able to take care of that weakest link, we might not get it right.
Now, that also raises the question of higher chances of community transmission. But then, if you look at the strategy that Lagos has adopted, they've decided to take the fight to the communities, visiting various communities and all of that. And it is something a number of people are advocating from, various quarters. Even it's the same thing that South Africa has been doing. In your own opinion, how good is that? I mean, it's not, I don't know the process, the details of it, but that is one reason that, we have been able to record these cases in Lagos. What do you think of that strategy, and how well do you think we're doing with that?
I think that strategy is the ideal way to go if we are serious as a country, and if we want to do everything that is needed to be done to contain the spread of coronavirus. And we have to follow the demography. Lagos State and Kano State are the most populous states in this country. And if anything happens in those two states, if it is not taken so seriously, I can tell you we may have a big issue in our hand. And the community transmission is at the level of the community. And many of those people who are affected at the level of the community are not the elite that you say, okay, I want to walk down here, I want to do this. And some of them, unfortunately, believes in the alternative or traditional medicine. And therefore, we have a lot of charlatans out there who does not even know what coronavirus is, who does not know the difference between viral illness and bacterial illness, coming to tell people that, look, I have an ELISA that can take care of it. And that is the unfortunate thing. And people at those places will be using those drugs, and they will continue to infect people in the community. So the right thing that should be done is actually for the test to move into the community, to start getting the community people tested and taking out those who are positive so that they will not be a source of infection to other people. It is until we can ramp up and
Doctor,
get all this.
If you don't mind me butting in, you are not also unaware of the challenge or the challenges, that we have in the area of getting the things that are needed for this testing. That's one of the things that the government at various levels have told us. Well, yes, Lagos State government is adopting, this strategy of testing people. Oyo State has also come up with a walk-through testing facility. Ogun State has its own strategy. It seems that the various state governments have varying degrees or types of attacking this issue. That's also something that may give some people concern. Shouldn't we have a uniform strategy of attacking this, of fighting this war, as opposed to the different strategies that the various state governments are approaching?
Well, thank you very much. I think you got it very right in that respect, because we have stated severally when the Nigerian Medical Association in our last one or two press statement has come and called on the government to harmonize things. And it is until we harmonize things in this country, you see different levels of government coming to enforce their own lockdown. Some will say it's curfew, some will say you can move in the afternoon, some different methods. And if Nigeria is a sovereign state, it calls all government officials, all different levels of government to be able to harmonize things. Let us have a uniform thing. The Nigerian Medical Association is coming out with its own policy advisory statement to the government, because we have seen that we have a lot of gaps that if we don't effectively take care of them, we may not get it right. And coming back to what you have said, sincerely, if we are having a test kit, which is the ideal, and it is not rapid enough, and it cannot be done on site, that you have to take it through medium back and forth. These are areas that are causing that are the rate limiting areas. And we need to find a way in whatever guise for us to be able to take care of that rate limiting steps. And this is why the mass screening test comes in. This is area that we can quickly do this and get those who are positive to go and do confirmatory tests, and get those who are positive to quickly get them isolated out of the community, out of circulation, so that we can have a large number of people within a short period out of the circulation and stop infecting and reinfecting people. Until we do that, I must stress, it may be difficult for us to get as many as possible people with this molecular testing that is the best, is the most desirable, but as it is, we are not getting the best use of it today. You have you have stated this morning that Kano State, this is another area that you can have explosion if we do not control it early enough. Is the most popular state in the country. Today is not doing the testing. Meanwhile, Lagos State in the last few days has increased the number of centers that you are having the testing in
right.
20 local governments of Lagos State. And that is why you are seeing this high figure in Lagos. If we had been waiting for 1 or 2 centers, I can tell you we'll still be seeing 10, 20. Meanwhile, that disease, the infection will have been going like wildfire in the community. So we need to find another Nigerian way of resolving this issue so that we can get as many as possible positive out of circulation. We should not forget the fact that Nigeria is the most populous country in entire in the entire African continent, and our population, when you put it one-on-one with our housing, you know that we have so many of us staying under the same roof, and one person may infect 10 or 20 people within a short period.
I think it's also instructive to point to the fact that the PTF is saying that this is spreading like wildfire. And if there's anything we know about wildfire is the fact that at some point it might become uncontrollable, which is why I think it's important to explore some of the areas you have mentioned. But, talking about this rapid testing, it means we might need to, allow more hospitals or, health centers to be involved in this fight. But we've seen in Lagos, for example, hospitals being closed. In the report we played earlier for you, you saw that some hospitals were closed because of exposure. So if we're moving to this phase, how ready are we? How ready are private institutions to handle this sort of thing? I hope in a bid to create a solution, we won't be creating another problem on our hands. So how do we navigate through this?
Well, many of the hospitals that were closed down because the patient that came, it took some time before they could identify their status as being COVID-19 positive. If we have mass testing, these rapid testing kits, I can tell you within minutes, you'll be able to say this is positive, this is positive for COVID-19. You can, from there, transfer or refer that patient to another clinic or another areas, maybe the isolation area or center or the treatment center. And that will protect the hospitals from taking in patients, from treating patients while awaiting their results, which will take maybe 1 day or 2 days, sometimes up to 3-4 days. Okay? For that 3-4 days, that patient is on your bed. Your nurses, your cleaners, your doctors are having direct relationship, treating and touching that patient without thinking that they are COVID-19 positive. It is at that time that when the result comes out, that you have no option than to close down the hospital and fumigate the whole place because there may have been a widespread contamination. But if we have these mass screening tests, you can, at the point of entry, quickly take a sample, and while the patient is waiting, in 5-10 minutes, the result comes. If the preliminary result is negative, yes, treat the patient. If it is positive, ask the patient to go to the isolation ward for confirmation and possible treatment. At the isolation ward, doctors and other health workers who are there are more careful in interacting because they know that these cases are having higher index of suspicion of being COVID-19 positive. We cannot afford to have all hospitals, especially private hospitals, to be closing down by the time they have admitted a patient and they subsequently know that the patient is a COVID-19 patient. But we must also be able to explain to people that diagnosing a patient as COVID-19 is different from treating a patient who is COVID-19. Many of these private hospitals that have been closed down are not treating patients with COVID-19. They admitted patient and they now know after that the patient is COVID-19 positive. And that hospital environment is not prepared because there are so many steps you have to take into consideration before you can treat such highly contagious diseases. And we must also learn from the experience of other countries that have had an explosion of COVID-19 infection, and most especially in Italy. There have been a write-up that the doctors in that place said one of the mistakes that they made was that they were treating COVID-19 patients in the general hospital's general ward, as if they can create somewhere and quickly treat them. And they said that one increased the nosocomial infection, that is infection from the hospital to other patients and other staff, that made that infection spread so fast within that country. So we must be able to quickly get those who are positive into the isolation or treatment centers so that we do not expose other staff and patients from from contracting the COVID-19 infection.
Well, we will still stick with you for a little while longer. After this break, there are a couple of other issues I would like to raise with you, so please stay with us. We'll be right back. Thanks for staying with us. We still have Dr. Francis Faduile, President of the NMA, with us in our Abuja studio. Doctor, tell us about this. You are not unaware of what's happening in Kano, especially with your members there and all over the place. You have also, referenced the fact that you are not sure the kind of cooperation that you are getting from the PTF about this fight and all. We've heard from the NMA chairman in Kano says that they do not have any cooperation from government about, they are not involved in the fight, so to speak. And the Oyo State NMA also said the same thing, even though the government of Oyo State has reacted to that one. One would expect, really, that members of the NMA, as well as every agency in the workforce, the health workforce, would all be marshaled towards this fight. The NERD president has also complained from time to time about the kind of treatment that they're getting from people, the government especially, about the way their workers are being, the health workers are being engaged. What is the position of the NMA with the Presidential Task Force on COVID-19, and how are the various branches of the NMA in all the states being taken on board in this fight?
Thank you very much. I think it's important for us to know that COVID-19 that has come to Nigeria need every person to be part of the management and treatment. And on the part of Nigerian Medical Association and other professional health associations, we believed that we need to be fully involved. We believe that we need to act our part. However, it looks as if the government has a different view, or the governments at different levels. They believe that maybe they know it all and they can do it by themselves. Yes, it's some of our members that are working in those technical committee or whichever committee they have. We have made a lot of noise to let them allow the professional associations to be part of the decision making, so that since our members are those that are at that state in which they execute it, we can tell them the situation on ground, and we can advise them appropriately. We can be part, we can have some input in some of the activities or decisions that they will be making. But I must tell you, it has been pretty difficult, both from the national to the different states. And while we are complaining, it's not as if they are also having interaction with the sisters association, like the National Association of Nigerian Nurses and Midwives. They are equally complaining, as well as the Pharmaceutical Society of Nigeria and other health associations. We feel that that is not the best way in which we want to manage this COVID-19 in this country. We have set up a committee on the national level comprising the Doctors Association, NMA, the Nurses Association, that is NAM, and the Pharmacy Association. And we have released a communique where we say we have a special task force, special response team that we are willing to interact with the government, to discuss with the government and get our experience into to bear. The same way we have asked all the state branches to do same thing, and every one of them has complied. Unfortunately, both the state government and the national government has not seen reason to call this all of us onto the table where these decisions are made. And some of these difficulties you are seeing may not be unconnected with not having all the full details and full disclosure of the situation. However, I don't think it's important for us to continue to start blaming ourselves at this time. It is for us to see how we are going to work things out. The doctors, nurses, pharmacists, we are bringing out our own plan of activities also in tandem with whatever the government is doing. If they don't want to hear us or call us to the table, we can continue to do our own best because Nigeria is our own. And the position of the government, I think, is not different from the position in which it looks as if they don't have any good things to say about Nigeria health system. And if it's not because that they have caused travel restriction, many of those people who are in those top level, they will have gone. Even when they have ordinary malaria, they go for foreign to have the foreign medical management. So, well, if they have that attitude, we'll continue to take care of Nigerians. We'll continue to do our best for Nigerians. But I think in this case, it is important for us to know that every stakeholder is important so that we can resolve these issues. There is no way you want to contain COVID-19 that is highly contagious, and you are not having relationship with the leadership of the different associations in the health sector. It will not make things work perfectly. We won't say that it will not work. It may not make
just
it
one
work.
moment. Just one moment. Do you think that the exclusion of your association and similar sister associations in the health sector in Nigeria is in a way making your members, the healthcare workers, vulnerable in that, if the political, technical committees do not understand, what is involved in the fight, in the things that your members do, that they may not be able to take decisions that will protect your members? Do you think that the exclusion of your members and that of other healthcare workers in the important decisions makes your members vulnerable?
Certainly, it's one of the fallout of not consulting us. And most importantly, in our activities towards the Nigerian patients. Because the ultimate thing is for us to see the welfare of our fellow countrymen to be taken care of holistically. If you don't have the other side from those who are executing, those who are interfacing, many of these people who are saying they are giving policy, they are sitting in Abuja, they are giving and doling directive, and they are not at that executing state. Okay, even in the state, you have the state government, the Honorable Commissioner for Health, they all sit down and they just give things. If you don't have a feedback system, and the feedback system, even if you take me into a committee and you invited me as a pathologist, I will just give advice as a pathologist. I cannot give a holistic view as the president of Nigeria Medical Association. There are two different things, because I have had a lot of people saying, but is it not your member that are here or here or here or here? No, their own perspective is different. If you ask me to come and talk, you have called me here to come and talk as an NMA president. I'm discussing as an NMA president. I've not come to discuss pathology, which is my area. By the time I start discussing pathology, I think the audience will change, and the understanding will be different. So the perspective of those who are working at those places is very important. But once they have decided, in our own view, that they don't want to use it, but instead of us to be fighting and causing distraction and not facing the real fact, I think we have decided we'll continue to do our own, advise our people. You see us giving directive to our people, telling them, let us do our best, let us continue to do this. We have a lot of this complaint or that complaint. We give them. For instance, at the time we came out, we said, Professor, you have heard the government saying, yes, they want to do researches in this country. How many times or how have you ever heard the PTF or any group of the government official saying they have given so amount for this research, for either vaccine, for how the things are going? Well, maybe they are doing it and I'm not aware because I'm not there. But these are areas that we can add into it, because we must be able to have our own homegrown way of resolving this issue.
Dr.
But
Fadile, I think that's a great place to anchor. You have raised major issues which we hope will be looked into in the coming hours, maybe days. But we'd like to thank you so much, not just for the work you have done here today, but the work you're doing on the field for your members and other members of the health team. Thank you so much. We've been speaking with Dr. Francis Fadile, the president of the Nigerian Medical Association, this morning.
thank you very much. It's my pleasure.
All right.